Namaste viewers, I am Dr. Anil Kumar Patra. I am a consultant nephrologist and kidney transplant physician at Apollo Hospital, Visakhapatnam. Today we will be discussing a very important procedure called glycosurb adsorption procedure, which is required for ABO incompatible transplant. Here our patient is a software engineer. He is on maintenance hemodialysis and we have planned for a kidney transplantation, but he doesn't have a ABO compatible donor. That's why his father came forward for donation whose blood group is A positive and our patient is O positive. So in those cases we have to remove the antibodies from his blood before the transplantation. So this antibody removal can be done in two important ways. One is repeated sessions of plasmapheresis, or the second one, which is called a glycosurb adsorption procedure. The difference is, like in plasmapheresis, we have to do repeated sessions of plasmapheresis, which can cause some hemodynamic instability. Patient can go for a low blood pressure, chances of infection is there. But here only one session of the adsorption is almost sufficient, and if the procedure is done well, then it can decrease the antibody levels to almost like 4 logs. Means, suppose before the procedure patient has a antibody level of 1:128, that can come down to 1:64, 1:32, 1:16, or as low as 1:8. So which is sufficient to take up the patient for transplantation. Here what happens, I will just explain the procedure. Here this is AB fistula, which is being used for dialysis also. This is the arterial line where the blood comes out, goes to the blood pump. Here we use two machines simultaneously, dialysis machines. This is very important. So in the first machine, the blood flows like this and it goes to the plasma filter. This is not a regular hemodialyzer, it's a plasma filter where the plasma is separated from the blood, and this plasma is again goes to, this is the main important thing in our session today. This is the most important thing. This is called glycosurb. Glycosurb is used for removal of the antibodies, that is anti-A antibodies from the patient's blood. So this plasma runs through the glycosurb column, and once it comes out, it again goes back to the patient's blood. Here the main difference from plasmapheresis is that in plasmapheresis or plasma exchange, we have to discard the plasma. Here we are not discarding, the plasma is again mixed with the blood and goes back to the patient. So the basic difference here is we are using two dialysis machines simultaneously, one for the plasma filtration, the other one is for removal of the antibodies using a glycosurb column. This glycosurb column is coated with antigens. So this patient has A group antibody, so that has to be removed by this column. Because the donor is A, so we have to remove anti-A antibodies from the patient's blood. So this column is anti-A column. Suppose patient donor is B group, then we can use the column that is called anti-B column. So here we are using anti-A column, and this procedure, here in this procedure the pump speed in the plasma flow is around 1/4 of the blood flow there. Blood flow is 200 ml per minute, whereas here in the plasma flow will be around 50 ml per minute. So that will prevent hemodynamic instability of the patient, and we can complete the procedure. We usually do the procedure around 8 to 10 hours. So this is what is the very important and procedure we are doing, and this is much more beneficial as compared to the plasma exchange procedure. We'll come back with some other educational videos. Thank you so much.